sudden collapse. This is what sudden cardiac arrest in an athlete looks like.
And collapses, just like Hamlin did in sports from football to lacrosse to baseball.
In Marc-Vivien Foe, he shows all the signs of sudden cardiac arrest, continued breathing after collapse, eyes open and rolled back, the face of sudden cardiac arrest. For Damar, after his arrest, his arms go up with seizure-like activity.
Okay, a cardiac arrest is when the heart stops beating. It is an electrical problem. A heart attack is when a blood vessel that supplies the heart with blood is blocked. It is a circulation problem. You'll sometimes hear a heart attack called a myocardial infarction or acute coronary syndrome. Now hear this, a heart attack can cause the heart to stop beating. Once the circulation stops, the electrical impulse through the cells will stop, and that causes a cardiac arrest. So a heart attack can lead to a cardiac arrest, but not always, and not necessarily. So let's talk a little bit about cardiac arrest. Our body completely relies on the heart to pump oxygenated blood from our lungs to all parts of our bodies. One of the largest consumers of this oxygen is our brain, and without a steady flow of oxygen and glucose, we quickly lose consciousness. When our brains are starving for these things, it can look a lot like the body is seizing or having a stroke. So what may appear to be a brain or neurologic problem could actually be a heart problem. What happens during a cardiac arrest is the electrical flow through the heart is compromised. Again, this could be due to an occluded coronary blood vessel, but it could also be due to thickening of the heart muscle, which we call hypertrophy. It can happen for many other reasons, but an infiltrative process like sarcoidosis is not uncommon, or more common due to high blood pressure because the heart has to push harder, and as a result, it gets bigger. There are also congenital and genetic reasons the heart will increase in size, and that can lead to sudden cardiac death as well. So with the young athletes that fall over in cardiac arrest, it could be a genetic predisposition where they have an issue with the electrical system in their hearts that's only manifesting because of the sheer level of intensity of their training and performance. Inflammatory processes can affect the electrical flow of the heart, such as viruses and vaccines, and combined with the right circumstances can cause a cardiac arrest. But also, the heart may stop beating for many other reasons, including certain medications or drug ingestion, severe trauma, devastating intracranial processes like bad strokes, and sometimes other stressors like surgery or emotional stress can send someone's heart rhythm into chaos and cause a cardiac arrest. So a heart attack is almost exclusively used to describe a process of a blocked coronary artery. It really is a bit of a misnomer because when the heart stops beating, it feels like an attack, but really when the heart stops beating effectively, that is actually called a cardiac arrest.